Well, India's healthcare landscape is at a tipping point as we battle a dual burden of lifestyle diseases and communicable illnesses. It's no longer enough to just treat what is visible. We understand that prevention is emerging as the first line of defense, but what does preventive healthcare truly mean in a country like ours where access, awareness, and affordability remain huge barriers? We have with us Dr. Ashutosh Raghuvanshi, who is the MD and CEO of Fortis Healthcare. Thank you, Dr. Raghuvanshi. My first question to you, sir, I was looking at some of your interviews, and you have been focusing a lot on preventive healthcare. What does this mean in the Indian context? Because in India, we often look at hospitals as places you go to when you fall ill. How has that shift really reflected in the operational style of hospitals like yours?
Yeah, I think there are two parts to this question. And the first one is that most of the systems around the world are designed around illnesses and hospitals. It's curative health is where the focus is. And it is not unique to India, but it's all over the world. And the focus has always been on that side. However, I think in a country like India where there are two diverse sets of population. We have a rural population which is suffering not only from the exposure to communicable diseases, which are still there. There is still a significant burden. They are also having non-communicable diseases. Incidence is increasing as well at the same time. And at the same time, the urban population where obesity and such things are becoming a real-time problem. So in a country like India, if you look at our healthcare budget, and if we focus that entire budget on the curative side of this, we simply cannot afford as a nation. So prevention is an important part. Having said that, prevention is not something new. Preventive medicine has been there for a long, long time. And that's precisely the reason why the incidence of communicable diseases has come down around the world. And there are phenomenal examples. Polio is one glaring example, but there are several other examples of where the preventive part, especially the vaccination part, has, though nowadays, there are a lot of vaccine naysayers as well. But at the same time, I think what has been achieved is phenomenal.
Right.
And we have gone quite ahead in terms of prevention. But different levels of prevention, primary, secondary, tertiary, are required. In India, different set of populations require different set of preventive measures.
Right.
And as I was listening to the previous panel, and there is so much of information around, but all that information is not getting channelized somehow, and it's not becoming actionable at an individual level.
Yes.
So I think we need to focus on that.
Right. Dr. Raghuvanshi, there's one more word that we keep hearing, and that's wellness. How do we become a society that's, conscious about the diseases that it has, to being a society that is also very, conscious about the aspect of wellness? What are you doing in Fortis Healthcare to bring in that concept? Because when we look at hospitals now, they're becoming happy spaces. You see a lot of diagnostics. There's data that is explained to you. How do hospitals or private healthcare spaces become happy spaces for people to bring in more positivity and not just look at fixing the problems in their bodies?
Yeah, I think that is very important. Wellness is the concept which private healthcare is adopting more and more in different formats. So we also are doing our bit. And in that regard, we have identified few key areas which we think are very, very important and which are underserved as well. So mental health is one such very important area for us. And we have done several measures there. But other than that, we are also creating an online platform which is for counseling for people, which is not for treatment, but for counseling when people need to talk and they want that kind of support. That is available 24/7. And The third one which we are doing is to create infrastructure, physical infrastructure, which is for the patients who require interventions in mental health space. So that is one area which we are working for. Other than that, we are creating the wellness centers in all our hospitals. One of the areas in the diagnostic is the genomic sequencing, which is a good predictor of a lot of diseases one may have in future. And that can give rise to a specific preventive plan for an individual, a personalized preventive plan for an individual. So we have this next generation sequencing, which can give the report the same day, so that increases the kind of probability of preparing a kind of personalized plan for an individual.
Dr. Raghuvanshi, also what would you tell a lot of people who use AI, ChatGPT to understand what's happening to them, when it comes to preventive healthcare? What is the red line that they need to draw for themselves?
I think one has to understand that these tools are not yet there. They do give an indication, but that indication could be wrong also. At the moment, at the best, you can get 60-70% accuracy, not beyond that, and sometimes even less. Because ChatGPT is going to give you analysis based on what inputs you give. So if your inputs aren't correct, your output is not going to be good. So it's not the limitation of ChatGPT, but it is also the limitation of inputs. At the same time, the tool is a self-learning tool. Yeah. So the more people seek information from it, the more accurate it will become. So at the moment, I feel that its role of artificial intelligence is only in assisting doctors in making diagnoses or getting to some conclusions. But for patients to self-manage based on ChatGPT is a little risky at the moment.
Do you see a lot of patients coming to you after looking at what ChatGPT is telling them? Do you have to face those challenges of telling them that this is not entirely correct and I'm going to tell you what is important?
Yeah, I am not in clinical practice at the moment, so I don't have personal experience like that, but I do keep hearing all the time that this happens, people come with their symptoms. But an aware patient is always better than a patient who is not aware. So I don't think it is a negative that people are doing research on their symptoms on Google and ChatGPT or whatever other tools they might use, because that means they are taking care of their health and wellness becomes an important part of that. Right. So I think an aware patient is a better patient.
Okay. Dr. Raghuvanshi, also, a wellness-driven approach, does it work for big hospitals like yours? Because a lot of it is dependent on patients who are ill, who have these severe illnesses. How has it worked for Fortis Healthcare, the shift going to preventive healthcare from something like, just say, that was centered around illnesses?
So it is not binary that you do preventive care or you do only curative care. Both the areas are equally important. And both will be required. As I was saying earlier, that preventive care has been there for a long time, but it has to become more focused. I think both have to be done. For private setups, it is a challenge to decide because there are commercial interests, etc. However, it is a moral and social imperative on the healthcare industry. Unfortunately, we call ourselves healthcare industry, but we only focus on illness. That should not be the case. We should be focusing on good health.
That's very important. Focus on good health and wellness. While we wrap out of this conversation, we look forward to a 5-part healthcare series featuring Fortis Healthcare on NDTV soon. Here's a look at this partnership which promises to decode the evolving healthcare sector where prevention is no longer a choice. It is a necessity and wellness is priority, like Dr. Raghuvanshi also said. Let's have the logo now. Dr. Raghuvanshi, what are your thoughts on this logo and on this partnership? And also, something, a collaboration like this, how important do you think it is for the realm of preventive healthcare?
No, this is extremely important. I think NDTV has been the path breaker. We had earlier a relationship on the organ donation for many, many years. And I think this relationship will continue. I think media's role is very, very important. It brings it into the focus, and it is the information which is reliable information. So that makes it even more valuable.
Absolutely. Thank you so much. Mainstream media is a reliable source of information, and like Dr. Raghuvanshi says, that one has to be really careful when it comes to tools which are still evolving. As we close this conversation, one thing is clear: healthcare is no longer about hospitals, but it's about habits. Fortis Healthcare, in collaboration with NDTV, brings you a 5-part healthcare series that unpacks this evolution from illness to wellness, from reactive to preventive. Join us as we decode how India's healthcare is not just healing lives, but also empowering them.
In today's fast-paced world, stress has become a part of our daily lives. Deadlines, personal expectations, family responsibilities. We all deal with pressure, but the important question is, when does daily stress stop being normal and become a serious mental health concern? आज हम बात करेंगे कि मानसिक स्वास्थ्य के संकेतों को कैसे पहचाना जाए और कब ये सिर्फ थकान या तनाव नहीं बल्कि एक गंभीर समस्या बन जाती है. And also, when should we seek help and from whom? Joining me is Dr. Sameer Parekh, Director, Department of Mental Health, Fortis, Dr. Bhavak Garg, Associate Professor and Senior Consultant Psychiatrist, और Dr. Manushri Gupta, Senior Consultant Psychiatrist. आप सभी लोगों का स्वागत इस मंच पर. Let me begin with you, Dr. Parekh. We all feel stressed at times. When should we start feeling concerned about it, and that level of stress is not the usual daily routine stress?
No, I think two aspects to this. Stress is a part of everyday living. It's not possible not to experience some kind of stress related to something or the other. I mean, we are sitting here having a conversation. I mean, I need to have enough stress to have enough focus right now to prepare for it. You would have had your preparation. If you're not stressed enough to plan and prepare, you wouldn't do well. But if you're so stressed that your mind numbs, you aren't able to think, you have a blackout, you fumble, that also is a problem. But stress is a part of our life. चाहे वो हमारा personal relationships हो, workplace हो, academic हो, रोजमर्रा की hassles हो, stress जिंदगी का हिस्सा है. The difference is we all need to have the right kind of coping skills to be able to deal with this stress. ये एक हिस्सा हुआ कि हम अपनी coping skills को इस तरह से रखें कि रोजमर्रा की जिंदगी के stress को manage कर सकें. और वही mental health है. Mental health is recognizing your strengths and being able to deal with the daily stresses of life. On the other side are mental illnesses. And it's important to see them as two different parts. Mental illness, like any other illness,
Physical
needs
illness,
to be treated like how you would treat any illness. You go to an expert, you take medications, therapy, lifestyle, whatever is involved. And for stress, you continue to evolve, learn, be open. And those are the two ways you need to look at it.
बिल्कुल. अब डॉक्टर गर्ग, हम सब ये जानना चाहेंगे कि जो अर्ली स्पेसिफिक वार्निंग साइंस हैं, शायद यहाँ हॉल में मौजूद सभी लोगों को ये जानना ज़रूरी भी है, वो क्या हो सकते हैं जिसके बाद हमको चिंता करनी चाहिए?
Like sir said, that stress is a part of everyday life, and we call that as eustress. And the stress, when it goes beyond the abilities of a person, the abilities till the time the person is able to cope, then it becomes distress. So you means good and dis means bad. So all of us, we need that stress to function properly. Till the time we have eustress, our performance becomes optimal. But when it becomes distress, it goes beyond the coping abilities or skills, then it leads to impairment in the functioning. And this is what is most important for us. For us mental health professionals, for us psychiatrists, any kind of dysfunction, be it social or occupational, सामाजिक और व्यावसायिक जीवन पे जब बुरा असर पड़ने लगे, इंसान अपने रिश्ते नहीं निभा पाए, बाहर जाने से कतराने लगे, avoiding meeting people, going to various gatherings and parties, occupational dysfunction होने लगे, काम में efficiency poor हो जाए, absenteeism from workplace, और students के case में academic performance decline होने लगे, right? So when these things happen, then we say that it is now amounting to possibly a mental health issue or a mental health disorder. It's beyond the normal stress of life. Similarly, जो warning signs की अगर हम बात करें, so they will also occur on a spectrum. हम जब स्ट्रेस में होते हैं, तनाव में होते हैं, so earliest thing that usually happens with us is our sleep gets disturbed. और there may be changes in our appetite. कई बार भूख ज़्यादा लगने लगती है, कई बार भूख कम लगने लगती है. लंबे समय तक हो, there can be changes in weight. छोटी छोटी बातों पे we start getting irritable. बहुत जल्दी चिड़चिड़ापन होने लग जाता है. कोई कुछ भी कहे, we snap very quickly, we reply back harshly, or we are not able to comprehend a situation. Suddenly going blank. Conversation में हम involved है, suddenly our mind may wander. We get distracted very easily. So these are some signs which show that there is some mental health stress, irritability, impairment in sleep, change in appetite patterns, change in weight, snapping easily, right? So all these are indicators or early warning signs of stress. But at the same time, again a word of caution, just having these does not mean कि mental health disorder or mental health issue हो गया है. Only if they are present, which comes to the second part of how we define a mental health issue or a mental disorder, if it becomes persistent and pervasive. जब ये ज़्यादातर दिनों के लिए ज़्यादातर समय रहने लगे ये लक्षण, then we call it a mental disorder, and we have different classificatory ways जिसमें duration defined है. For example, for depression it's 2 weeks, for mania it's 1 week, and so on and so forth. Right. So early warning signs. Yes, there is possible stress. Something needs to be done. Maybe lifestyle modification, venting out, talking to your friends, to your neighbors, to your relatives, to your work colleagues. If it becomes persistent, pervasive, and leading to social and occupational dysfunction, then possibly professional help is required.
Talking about the early signs of stress, and we are seeing nowadays the younger generation, the school-going children are facing these issues. We really want to know what role can parents and teachers play in identifying the stress, the issues which the child is facing at a very early stage.
Parenting, yes, and I'm glad you spoke about young children. So it's been known since last 20 years or so through a robust body of evidence, such studies which have been carried out over 50 years, 60 years. They have identified parenting as the most important risk factor for somebody to get mental illness later in life. So we don't emphasize parenting enough, and we are all at sea how to do this job very well. So parenting skills, parenting workshop is very important. And similarly, teachers in later part of childhood become proxy parents. When the child starts to withdraw from his immediate parents, the parental figure, teachers are the next important figure in anybody's life. So it cannot be overemphasized that parents in early childhood and school teachers in later childhood play a very important role in the identification of stress, mental health issues in young children. Now, it has been known for some times that early childhood adversity, any kind of trauma, any kind of abuse, like for example, bullying in school, or any kind of physical or sexual abuse that a child may go through at home or school, is a very important risk factor for mental illness. So when we say how to identify, of course, in young children, the primary marker that has been understood is a fall in academic performance. We often emphasize how the child is doing academically at school. So one of the first markers of any kind of adversity is fall in academic performance. And then similarly, the children are not very good at articulating their stress, their inner emotions. So we gain much information by observing, by free play, right? So how the child is reacting to his immediate peers, maybe his friends, if he or she is undergoing any kind of withdrawal, any kind of social withdrawal, he has become irritable, or he has become aggressive or violent with maybe his toys or his peers. That may be one of the first signs of any kind of stress in the child. Right. Thank you.
Dr. Parekh जी, जो बात यहाँ पर कही जा रही है कि जो ट्रिगर पॉइंट्स हो सकते हैं या फिर अर्ली साइंस हो सकते हैं, यहाँ ये समझना ज़रूरी है कि अर्ली चाइल्डहुड में अगर किसी तरह का पैटर्न देखा गया, क्या वो तुरंत रिफ्लेक्ट करता है या फिर आपके अडल्ट लाइफ में वो आगे जाके कभी रिफ्लेक्ट कर सकता है?
बिल्कुल, हमारी ज़िंदगी में जो एक्सपीरियंसेस हैं, स्वाभाविक है कि वो हमारे जीवन भर हम पे असर करते हैं, खास करके आई मीन बोथ पॉजिटिव एंड नेगेटिव। और मुझे लगता है क्योंकि सबकी ज़िंदगी में किसी न किसी तरह की परेशानियां आती हैं, स्मूथ लाइफ इज़ नॉट पॉसिबल, कैसे मुमकिन है? मुझे लगता है कि सोल्यूशन की बात हमें ज़्यादा करनी चाहिए, और मेरा ऐसा मानना है कि स्कूलों में मेंटल हेल्थ करिकुलम होना ही होना चाहिए, मतलब ये नॉन नेगोशिएबल है। और मेंटल हेल्थ करिकुलम टीचरों के माध्यम से होना चाहिए, विच मीन्स टीचर्स की ट्रेनिंग हो ऑन मेंटल हेल्थ, बेसिक चीज़ें, अर्ली आइडेंटिफिकेशन, लैंग्वेज, स्टिग्मा, वेलबींग, कोपिंग स्किल्स, किस तरह से आप क्लासरूम को एक आइडियल एनवायरनमेंट बनाइए। देखिए, आप ऐसे समझिए, एक क्लासरूम भी एक छोटा सा एनवायरनमेंट है। अगर आप हर क्लासरूम के एनवायरनमेंट को पॉजिटिव करते हैं तो स्कूल पॉजिटिव होता है, सारे स्कूलों को करते हैं, दैट्स हाउ द सोशल पॉजिटिविटी आएगी। ये तो आएगी नहीं कि कहीं पे हमने यहाँ कुछ कर लिया, वहाँ कुछ कर लिया। सो मेंटल हेल्थ करिकुलम होना ही चाहिए। दूसरी बात मुझे लगता है कि मीडिया लिटरेसी, ये समय आ गया है कि मीडिया लिटरेसी के बारे में बहुत स्ट्रांगली काम करना चाहिए स्कूलों में, खास करके। एक इतना इंट्रूसिव नॉन स्टॉप एक्सपोजर है वेरियस फॉर्म्स ऑफ मीडिया का, कि अगर हम बच्चों को ये काबिलियत नहीं देंगे, स्किल नहीं देंगे, हाउ टू नेविगेट एंड बी लिटरेट टू डू। और तीसरा, पिकिंग अप फ्रॉम व्हाट मानुषी आल्सो सेड, इस बुलिंग पे काम करना ज़रूरी है। एविडेंस है कि बुलिंग एक सिग्निफिकेंट फैक्टर है अडल्ट लाइफ मेंटल कंडीशंस के लिए। तो अगर हम इन 3 चीज़ों पे भी अगर काम करना शुरू करें, आने वाले दशक में हम काम करें इसके ऊपर, तो जब हम एजुकेशन पॉलिसी की बात करते हैं तो बिना मेंटल हेल्थ के तो कोई पॉलिसी हो ही नहीं सकती है।
बिल्कुल।
अभी हम प्रिवेंटिव हेल्थ की बात करते हैं तो बिना मेंटल हेल्थ के प्रिवेंटिव हेल्थ नहीं हो सकता। हम हेल्थ की बात करते हैं, बिना मेंटल हेल्थ के हेल्थ नहीं हो सकता। जितने लोग यहाँ बैठे हैं, जो बाकी सुन भी रहे हैं, आप हेल्थ डिफाइन करिए, और हेल्थ डिफाइन इस तरह से करके दिखाइए, डेयर है, जहाँ पे मेंटल हेल्थ का जिक्र ना हो। आप बोल नहीं पाएंगे, कंप्लीट नहीं कर पाएंगे हेल्थ को। जिस चीज़ के बिना हेल्थ नहीं है, उस पर हमारा कितना एम्फेसिस है, चाहे वो हेल्थ केयर प्रोवाइडर्स हों, चाहे एजुकेशन हो, चाहे वर्क प्लेस हो, पॉलिसी मेकर्स हों, मीडिया हो, ऑल ऑफ अस नीड टू अंडरस्टैंड कि हमें स्टेक होल्डर बनने की ज़रूरत है। खाली ये जो थोड़े बहुत एक्सपर्ट्स हैं, इनसे नहीं हो पाएगा। एडवोकेसी की ज़रूरत है, और उसके लिए एवरी पर्सन हैज़ टू बिकम अ मेंटल हेल्थ एडवोकेट।
Every day is a mental health day, and the mantra is unmute yourself, talk to people, don't be limited to your rooms and your digital devices. Thank you so much for this great conversation, and this conversation should carry on beyond this platform too.